Everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about corticosteroids and what role they play in managing knee pain and arthritis. So today we're talking about corticosteroids, and these are basically steroids that are either produced by your body, so produced by your adrenal glands, or you can have them taken as drugs or medication. So some of the common ways to take corticosteroids is either topical, you can take them through oral administration, or the most common when it comes to knee pain and knee arthritis is injections. So the goal of corticosteroids or cortisone injections, or whatever you may commonly hear them referred to, maybe glucocorticoids, the role of all of these is to reduce the inflammation, and specifically reduce the inflammation very locally in your knee joint. By reducing the inflammation, the goal is to decrease your pain and in turn improve mobility, improve function, and just decrease the impairments and discomfort and stiffness of your knee joint. Now, when it comes to cortisone injections, a lot of times you want to make sure that before taking the route of an injection, which is something that is considered invasive, something that carries some level of risk with it, probably less risk and less invasive, obviously, than a surgery, arthroscopic surgery or knee replacement surgery, but still is something that is invasive, something that you're injecting into your knee joint, into your body, and does carry some risks with it. Before considering a cortisone injection, you really want to look at, have I done the first step type of things, the conservative treatments, and that may include activity modifications, being educated on kind of what is going on with your knee, what is arthritis, how to manage it effectively, possibly some weight loss or healthy weight management, doing physical therapy, doing regular, consistent physical activity and or exercise. These are all kind of the most conservative, the first line of defense, the first approach to managing knee pain and arthritis. If these seem to be ineffective, if these seem to be not as effective as we'd like, that's when you start to look at some of these alternative options for treatment, such as cortisone injections. Now, there are definitely some limitations to cortisone injections. One of them is how long does it provide relief? So this is going to be very different between individuals. Some individuals may get a cortisone injection and have no pain relief at all, or no improved mobility at all. Other individuals, most cases, will have some level of relief from the injections. So typically the relief lasts anywhere from a number of weeks to typically the longest you see is maybe 6 months or so. And the average is somewhere in the range of 6 to 12 weeks of relief and of benefit. And so that's kind of what you're thinking right off the bat, is this is more of not a long-term solution, but more of a treatment that's going to give you a relief for some period of time. And so something that you might want to use strategically at some place wherever you are in your journey and your management of knee pain and arthritis. Some other things to keep in mind is that with repeated injections, more and more injections, the relief and the benefit that people tend to notice tends to diminish. So typically the first injection will provide the most benefit and feel the best, and then subsequent injections will have less and less of an effect for the individual. Other things to keep in mind is with repeated injections, you're increasing your risk of some complications, some potential risks. Some of those risks and complications are, some of the different things are, you might have increase the speed of cartilage loss or damage to the cartilage or ligaments or soft tissue of the knee joint. There is a possibility of infection, and there is a possibility of things like bone fractures as well, although these are relatively low percentage and low likelihood. There is definitely an increased risk with the more and more that you have these injections. And the big thing that there's a lot of controversy and a lot of talk about is there seems to be research supporting that with cortisone injections, particularly multiple injections, you're actually increasing the rate of breakdown and aging of the joint. So increasing the rate of breakdown of the cartilage, the ligaments, the tendons, the soft tissue of the knee joint. And so what you're potentially doing is increasing the likelihood and the how soon you might need a knee replacement surgery. So something definitely to keep in mind as well. So along those same lines, there's limits on how frequently you should have a cortisone injection. So typically they recommend no more than every 6 to 12 weeks or so. And typically you don't want to do any more than 2, at the max 3 injections within 1 year, a period of 12 months. So you really want to space them out and try to limit how many injections you have because of those increased risks and potential complications that I just talked about. And some other things to keep in mind is if you are planning knee replacement surgery and say, you're just trying to maybe delay it or push it back a little bit for whatever reason, and you just want to get a cortisone injection, have some relief for a number of months or weeks maybe, and then you know that eventually you're going to need a knee replacement surgery. Something to keep in mind is you don't want to have a cortisone injection, and many surgeons won't perform knee replacement surgery if you've had a cortisone injection within 3 or even up to within 6 months of the surgery date. And the reason for that, again, is there's that increased risk of potentially complications. There's an increased chance of requiring a revision knee replacement surgery down the road. So we don't want to play around with those increased risks, those increased chances of complications. So usually they want you to wait at least 3 months, sometimes up to 6 months after having your last cortisone injection before having knee replacement surgery. So that's something definitely to consider and keep in mind as well. So all these things considered, what else do we want to think about? There's also treatment of physical therapy treatment, and there have been some studies done, and actually one relatively recently that was published in 2020, and it looked at comparing physical therapy treatment and cortisone injection treatment. And the study seemed to conclude, and I won't go into the details of the study, but it seemed to show that there is better outcomes or of equal outcomes in terms of pain relief, in terms of symptom relief, in terms of improved function and knee function. And it seemed to be better for the group that had a course of many weeks of physical therapy than the individuals who just had cortisone injections. So this is something that you really want to keep in mind. So all this together, so you're looking at something that may be no better than potentially conservative treatment, exercise, physical therapy. There seems to be some research to support that. You're looking at something that is invasive and does carry with it some risks and complications, and possibly may lead to faster breakdown, faster aging of the joint, and sooner need for knee replacement surgery. And you're looking at something that has only short-term transient relief, so a number of weeks to a max of maybe 3 or 6 months of pain relief from it. So all those things to consider, you have to think about these if you are considering a cortisone injection. And you want to, of course, look where you are in your journey. What are your plans for the future? Are you planning knee replacement surgery? Are you considering knee replacement surgery? Have you tried conservative exercise, physical therapy yet? Are you currently trying those things? All these things you need to consider when looking at, is a cortisone injection something that is appropriate for me? I think more and more we're moving away from these having a cortisone injection because their benefits and the risks just aren't necessarily worth it in the long run. So that's an overview of cortisone injections. Of course, if it's something you're considering, talk it over with your surgeon, talk it over with your doctor, discuss the pros and cons, what you're trying to get out of it, what your goals are with having an injection, and go from there. This has been the Need to Know Show. Thank you very much for watching, everyone, and have a great rest of your day.